Good morning, everybody, and welcome to our virtual town hall for August 20th. I just wanted to thank all of you for being a part of this. I'm John Bratsakis, president of the Maryland and DC Credit Union Association, and honored to have you all join us. We've got a great session today, so we're going to jump right into it. I did just want to mention a couple of things. One, if you have a question, please use the chat feature or the Q&A feature at any time, and we'll be happy to get those questions answered. And also, a link to the recording and slides will be provided to everyone this afternoon. So again, thank you all for being here. Couple of quick things on the legislative side. We have a Climb the Capitol Fall Edition this year. We're going to be doing these virtually, but we currently, as of today, have September 15th set up with Representative Dutch Ruppersberger, John Sarbanes, and Jamie Raskin. And then on September 16th, we currently have scheduled Representative Anthony Brown, Steny Hoyer, and Senator Ben Cardin. And we're scheduling the rest of our delegation, so we'll be getting back to you. So look for more information. We'd love to have you attend any or all of these if you'd like. They'll be virtual, and I think given the proximity to the election, it'll be a great opportunity for everyone to engage and have some great dialogue with our delegation. And then we also are very fortunate, the Baltimore chapter meeting on September 8th is scheduled to have Maryland Comptroller Peter Francho is going to be the guest, and he's going to be talking about a variety of issues. And as you know, he's also announced that he's going to be running for governor. So the Comptroller Francho has been a strong supporter of credit unions in the past, and will be a great opportunity for folks to dialogue and engage and get an opportunity to ask questions about what's going on in Maryland. And then I'm sure there'll also be an opportunity for him to share his thoughts going forward with what he might be working on. So what I'm going to do now is I am going to turn this over to our first guests, which are John Jeffries, President and CEO of Callahan and Associates. As you all know, Callahan's a great partner of ours, and CU Analyzer through Callahan and Associates is one of the affiliation benefits to everyone. And I think John and Sam will be giving some great in-depth information as far as what's going on first part of the year. So I'm going to go ahead and turn this over to John and Sam.
Well, thanks, John. Good morning, everyone. Thanks for having us today. I think that what we thought we'd do is share a little bit about what we've seen in second quarter data, but also realize that a lot of credit unions are in their planning season, and certainly as we've done a number of strategic planning sessions, just talk about some of the themes that we're hearing credit unions talk about, or at least wrestle with, based on the second quarter data and what that might mean going forward. So, certainly, as we looked at the sort of macro view, Q2 2020 results, for the first 6 months of the year, were sort of surprising, right? We were pleasantly surprised by a number of areas, but also realized that there's a fair amount of uncertainty that is out there. So, it's clear credit unions are taking proactive steps to help their members through the CARES Act and other programs. Members are still choosing credit unions as a place for safety and security of their money, but then members are engaging more, right? They're taking advantage of low interest rates, and what we'll get into, there's been another quarter of record-setting originations on the lending side, right? So it's not only the liability side of the story. So if we take a look at the macro view, and this is nationwide, sort of the headlines, right? We look at assets are up almost 15% year over year, really driven by that shares, right? We're about up 16%, capital's up 9%, members up 3.5%. So, as you think about going to the Hill and talking to your representatives, right, we're a $1.7 trillion industry representing 123 million Americans, right? So I think that our power and our reach continues to grow as members utilize us. So that was nationally. If we look in Maryland, DC, Delaware, and Virginia, sort of the Mid-Atlantic region, and we took Navy out for this analysis, you can see similar trends, right? Assets up about 10%, share growth of 10%, loans up about 5%, but even more impressive member growth, up about 4.2%. So good numbers, strong numbers that we see. And we think that there's sort of 5 trends that will shape this year and really flow into 2021. So what we're going to do is we're going to do a little bit of a deeper dive in these 5 areas, but then end each section with some questions that we're hearing credit unions ponder. What do these mean and how might they influence our plans as we go forward? So the first one's liquidity. Sam Taft, our Assistant Vice President of Analytics. Sam, do you want to jump in and talk a little bit about liquidity?
Yeah, thanks, John. And thanks for having us on today. The other John, we appreciate the opportunity. So from a liquidity perspective, as John noted on that prior slide, lending's going strong, but what's the implications for all this funding that's coming in? And so what we're looking at on this slide is just over the last 6 months, over the last 5 years, what are you seeing in terms of inflows? And you can see the chart really tells the story. In the first 6 months of this year, we have 174 billion in funds that have come in. Normally the first quarter, right, of the year is obviously the largest with tax inflows, bonuses, refunds, et cetera. However, this year just kind of breaks all those records. And so if you go to the next slide here, where we're looking at annual growth, it really reinforces that trend, double-digit annual growth. But I think it's helpful to really understand what that impact is by going down a level. So if we look at where these funds are going, so where are members directing their savings that are coming into the credit union, I think we can learn a lot. And so as you can see here, the red bars are the percentage change in balances in 2020, so over the last year compared to the prior year. And you can see all 3 of those that are circled in double digits are what we call core deposits or core funding. These are generally stickier accounts. They're less rate sensitive. And more importantly, also, they tend to be cheaper from a depository perspective. This is a sharp contrast from what we saw over the last couple of years, where there was that rush to bring liquidity in. And so a lot of the deposits we saw coming in were certificates, which obviously has a much different impact on a credit union balance sheet and earnings model. If we compare this on the next slide to what we're seeing regionally, it's a similar trend, but it's almost a little bit more exaggerated. The entire deposit growth that we've seen in the region is coming from core deposits. You can see even larger growth in the traditional savings account, or what we call regular shares and deposits. And you actually see a contraction in certificates just a year after those balances increased 15%. So this is really quite a diversion from what we've been seeing over the last couple of years. Now, if we go on this slide, you can see this is the net change in the deposit portfolio by product type. And it really just reinforces what we saw in the last slides, really the growth in these savings, that big orange bar at the bottom, and then the checking account right above that, which is gray. So then the question is, well, why is this happening? So obviously COVID has changed the way a lot of things do business. Part of it's flight to quality, not spending as much, a combination of all of these. And then related to this is, how are members using our institutions? And so we like to measure that with checking account penetration. You can see the good news is, despite all these funds coming in, we're still able to not dilute the growth in checking accounts. It's coming in across the board. So the way to interpret this would be 6 out of 10 average credit union members have a checking account with their institution. So that's what's coming in. We saw on the initial slides about what's going on with loan growth of about 6%, which is still modest, but just the sheer volume of shares that are coming in the credit unions are depressing the loan to share ratio, which for some institutions, this might be a welcome change. We heard more and more from credit union leaders in recent years about regulators being more focused on managing liquidity positions, et cetera. But Obviously, if you're not lending out as much and investments in this environment are earning minimal amounts, this is going to present challenges, which we're going to see later in the earnings analysis. So this kind of begs the question, what else are we hearing from credit unions? What other types of questions are people asking? And so on this next slide, you can see, here's how we're kind of thinking about it. These are the most common things that we're hearing. You know, the $174 billion question in this case is, how long is this money going to stick around? The closest thing we've heard to a consensus is maybe 3 to 6 months. That seems to just roll forward every time I talk to somebody. But then the question is, okay, so if this money's sticking around, what do you do with it? Do you portfolio 30-year fixed rate mortgages and just assume that interest rate risk at 2 3/4 or 3%? Or do you go and you buy a 5-year MBS that might have extension risk and really isn't competitive from a yield perspective? What else? What other types of risk are you comfortable taking on? You know, I know 3 quarters ago, people were interested in adding credit risk to their portfolios, both on the loan side and on the investment side. Has COVID changed that? And then finally, what are the implications for capital with all these deposits coming in? Right now, we've seen capital levels are still growing. However, just by pure mechanics of how the balance sheet works, you know, I think we lost over a percentage point nationally in the average capital ratio. So we're not in a position where there's a problem today, but things to consider and think about as you think about your credit union's position.
Right. So that's the first theme that we're hearing is liquidity, right? You know, we've seen all these shares come in, and you know, that's a good challenge that we've seen. But you know, on the other side, we've seen record mortgage activity. You know, this is a chart showing origination. So you can see that the very top number is originations year over year went up 26.5%. And that is really driven by the bottom red bar, which is first mortgages. First mortgages were up almost 94% year over year, $130 billion of mortgage origination. So you can see that consumers down a little bit, commercials up a little bit. A lot of that is the PPP program that many credit unions participate in, and then you know, other real estate is down a little bit. So overall, the you know, 26.5% origination growth is a really strong number, but that's really driven by the first mortgage origination. So if we take a look at the first mortgage origination a little bit, you can see that about 3 out of 4, 78% are fixed rate mortgages, right? You know, members taking advantage of record low rates. It seems that almost every week or every couple weeks, there's an article announcing new record low mortgage rates. So you can see that, you know, members are taking advantage of that. You know, we originated almost $100 billion first mortgages in the first 6 months. So, you know, as we look at the categories, right, you can see that the first mortgage origination is growing, and this is outstanding, right? The first couple slides are origination, but certainly, you know, with all that first mortgage fixed rate business being originated, a lot of that's being sold to Fannie and Freddie. So this is on balance sheet. You can see mortgage growth is up 13%. Other real estate is down a little bit. You know, auto loans are down a little bit. At least new, used is up slightly. But overall, on balance sheet, even with that record origination, we've still grown our balance sheet by about 6.6%. If we look locally, right? You know, we've seen a similar trend, even more of a pullback on new auto, and also surprisingly credit card was down fairly substantially. I think that's, you know, our region may have had a little bit more of the shutdowns and taken the government mandates a little bit differently than other parts of the country. That's causing a little bit of data to be skewed there. But even nationally, even locally, we've seen total on balance sheet loans grow about 5.2%. I think one of the other things to look at, and one of the things we like to look at, is what's our market share, right? And you can see this is first mortgage market share. And you have a series of environments here, right? You have refi environments, you have purchase money environments. Over the past 10 years, our mortgage market share has more than doubled. We've gone from 4.1% to 8.6%. And especially right now, I think that's really telling, right? Because I think that historically, credit unions have done better in a purchase money market than a refi market. We're sort of in both right now, and we're still growing market share. So I think that's showing that members are becoming aware of credit and mortgage lending, that we're getting better at working with realtors, and we have a more complete suite of products to offer members across the board. So I think some questions for 2021, number one is, can there be more refi, right? We've seen this record origination level, much of it's refi. How much longer can this go on, right? And part of it, I think, depends on what are home values doing. Will members still have equity in their home, and how does that help? I think the other wild card is, just last week you had FHFA sort of put what I call a tax or a fee on all of the refinance loans that are delivered September 1 or later. Now, I guess there's been some talk that might get delayed till November 1, but what does that mean for refinancing activity, given that the rates on refi were already a little bit higher than on purchase money? Does that sort of slow down the volume? And then the last part is, given the environment we're in, how long is this purchase money market going to remain strong? So these are some of the things that we're seeing credit unions wrestle with as they develop the budgets and plan for 2021. So Sam, do you want to talk a little bit about the margin?
Yeah, that's a great segue, John. So given what we saw on the balance sheet, and then with all that real estate lending, what does that mean for earnings and margins ultimately? So we're looking at total revenue by segment here. The big thing to call out is just the way that we're seeing these components change in ways that we haven't in recent years. So specifically, interest income from loans is up only about 2.5%. That was increasing in recent years, not surprisingly with the rate environment. The two other important categories to talk about are those top two bars: other operating income, which is going to capture your interchange income and secondary market sales, and then fee income. Both have slowed in terms of growth in recent years. Other operating income got a boost because of all those secondary market sales that John was talking about, but the fee income has seen a pullback, because more members aren't going negative right now. It seems they're managing their finances much tighter. And then B, lots of fees are being waived as part of member relief programs. A good thing, certainly, but something needing to be considered in what it means for earnings at the end of the day. So we thought it'd be helpful also to show on this next slide how the rate environment is impacting funding costs and ultimately profitability. So historically, that red line is average cost of funds for credit unions. So historically, that's gonna lag changes in Fed funds rate, the blue line. You can see in 2018 and 19, when Fed funds started increasing in earnest, you saw credit unions starting to turn to different different deposit channels to retain and attract deposits, notably certificate money, obviously, which comes at a higher funding cost. Now that rates have started to fall in the back half of 2019, you see it's still lagging that cut, but we actually dipped down this year, not surprisingly as well, with that huge influx of savings and checking accounts this spring. So when you put it together, what does that changing interest expense mean from a net margin perspective? Here we can see the net interest margin versus the operating expense ratio. And you can see the net interest margin on average fell about 30 basis points from a year ago. Operating expenses also relative to assets have fallen, but that's really more a byproduct of that tremendous asset growth we're seeing. Deposits coming in, not being able to lend out entirely, so they're sitting in investment portfolios, but still pushing that asset balance higher. This suggests quite clearly that I think margin squeeze, John, is going to be the big thing to watch for the rest of this year, and see how credit unions are navigating that. Put it all together, you can see all the different yields, and the big story is, given everything that's going on in the rate environment, yields are down across the board. The biggest hit came from the investment portfolio, that blue line in the middle. We saw about a 70% increase annually in cash balances in the last 3 months of the year, or excuse me, the last 3 months, so from the first to the second quarter. And it's really just a reflection of member funds coming in, credit unions not really quite sure what types of assumptions to have around how to invest or lend those funds. And so they're sitting in overnight accounts earning 10 basis points compared to about 240 last year. So that's going to have a big hit. We like to put it all together in what we call an earnings model or a spread analysis. And it really just shows you the different components and how you get to ROA. This is for the national credit unions, and so you can see that first line, the impact of the decline in interest income down about 37 basis points. It's going to push the margin down. Non-interest income fell slightly, not quite at the level of interest income. The big thing to keep an eye on too, though, as it relates to earnings, is obviously provision expenses. So the second to last line, those are up about 40%, or excuse me, 50%, 50 nationally. We're seeing, based on credit unions in different parts of the country, different fields of membership, they're using different approaches to modeling this out. Some are taking a very aggressive approach, increasing their provision expensing about 3 times their average run rate. Others are actually decreasing, they're crediting. So we're seeing lots of different ways to do this, but net, you put it all together, provision expenses are increasing, hopefully to build that cushion. On the next slide here, just going to show it for the local region. A very similar experience pretty much across the board. Not quite as big of a hit on the non-interest income side, but a comparable increase in provision expenses as well. And that bottom line ROA dropping 39 basis points. So similar to what we've been talking about, what does this implicate or entail for 2021? What are the big questions? Liquidity, right? If it keeps going like this, what does that mean for margins? How are credit unions going to adjust the different ways that they're going to earn income on those funds? And then non-interest income, what's that balance on member relief and earnings? How do you navigate that? Member relief on one hand is obviously a good thing, but there are earnings goals and targets that you need to hit at the end of the day. What other types of non-interest income sources are credit unions tapping into? I know in previous years, if credit unions with large mortgage businesses have been able to pick up some extra non-interest income with pipeline hedging, for example, and dollar rolls, I think everybody's asking that question. What are you doing for non-interest income? So with that, I'm going to turn it back over to John to talk about asset quality.
Yeah, thanks, Sam. So, when we got the first quarter data, right, there was a lot of uncertainty. We were a couple weeks in sort of this national crisis. And if someone would have taken you to Vegas and said, what are the odds that delinquency will be down in Q2? I don't know that anyone would have taken that action. So that's one of the surprises that we've seen so far is delinquency is actually down. So this is looking at asset quality. So you can see that delinquency went from about 61 basis points to 58 basis points in Q2. Charge-off ratio remained similar. So part of it is through forbearance, deferrals. The challenge may be pushed out a little bit longer. But we've also seen in some anecdotes that a lot of members taking advantage of the programs are actually current, right? They're still paying. They just wanted the flexibility because of maybe some uncertainty on, is my job safe? What's it going to mean for me? My credit union's offering this to me now. I might as well take it because it may not be there later. So delinquency remains low, but I think the credit unions are cautious. You can see, this is locally similar trend. Delinquency down again quarter over quarter. So as Sam talked about, the other thing we've seen is credit unions continue to put significant amount of funds in the allowance, right? So we're preparing. The best analogy I've heard is it's sort of like where the whole industry is on an old-time wooden roller coaster, right? You hear the sound going up, clank, 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 and we're sort of going up the hill, and we're about to go down, but we don't know, are we on the kiddie coaster or are we on the double black diamond Six Flags, right? How bad might it be, and what's the implication going to look like? So I think creditors are continuing to put money aside, and so far we've put about $11.5 billion aside in the allowance. So if you put the the coverage ratio, which is allowance for loan loss divided by delinquent loans, nationwide creditors have $1.72 for every dollar of delinquent loans. Locally, it's about $1.31 or 131%, but you can see the upward trajectory. So what we take on that is creditors are preparing for credit issues down the line. We're relatively while earnings are reasonable now at 50 basis points, and that's even after we've been putting a fair amount of money aside. So the quarterly provision expense continues to go up. First quarter was 2.1 billion. Q2 you can see that 2.7 billion. So we are putting money aside. So I think the questions are, when will we see delinquency grow, right? That assumes that we will, and I think most people think that we will. But then, how much will it grow and how quickly? And then related is, will asset prices hold, right? I think in the last recession, 2008, 2009, we saw delinquency go up and asset prices falling, right? Home prices falling. So it was sort of like catching a falling sword at times. But so far, asset prices seem to be holding fairly steady. So those are some of the questions that we begin to wonder. And I think the other one is, what might the government do? Will be other government programs that will interplay here. So our last thought and our last theme is, what will the competition do, and how might that provide us some opportunities? So I think the first one is there's growing research out there that shows banks are tightening their lending standards even as demand remains sort of challenged, right? And the Federal Reserve Board, you can see on the far right side, almost 50% of banks are tightening their lending standards. So it's getting harder for people to get loans, or at least reasonably priced loans. This is small business side, right? You can see that as demand remains fairly steady, the supply, right, of how much money is available to small businesses is going down. Certainly, small businesses are one of the areas that have been hardest hit by the pandemic and sort of the economic side around it. That's why there have been programs like PPP to support them. But you see, American Express made a big play just the other day and made an acquisition. They bought Cabbage. So you see some areas of opportunity there where, if banks are stepping away, might creditors be able to step in some ways to help stabilize some of the economy. Certainly, I think most believe that we are going to see, maybe in 22, 23, or 24, a wave of foreclosures as members work through the economic fallout of this crisis. So I think that really lets us ask some different questions, right? As competition pulls back, should we lean in, right? I think creditors were designed to be counter-cyclical. How might we use this as an opportunity to smartly grow market share? I think another focus is, one of the lessons we learned in 2008, 2009 was our focus on keeping members in homes. Does that help us in the long term, right? How might we use that to position our narrative as we go forward? And overall, I think creditors need to be pragmatic in their approach, but also, how can we be aggressive, right? So how can we, and it feels like I'm talking out of both sides of my mouth, but how can we be cautious on one hand and at the same time find pockets of opportunity and try and grow market share, right? Have that mindset that we are willing to be there for our members, we're willing to be there for our communities, because if there's ever a time our members and our communities needed their credit in, it's probably now. So with that, open up to questions. And again, John, thanks to you and the team for having Sam and I today.
Thanks a lot, guys. I really appreciate it. One question that I don't know if there's data when it comes to the mortgage side of things is if there's any type of way to gauge, those loans that are in forbearance or that are continually getting extended through the servicing side of things. Are there reports that you all are able to see? I know our region seems to be doing better than most parts of the country per se, but it would be interesting to know, what might be gleaned from that.
I think anecdotally, you've seen the Mortgage Bankers Association come out with some statistics. First Americans also had some reports. I think what we're seeing though is, so forbearance is lower than what people thought in April. And one of the things is those members that are using a forbearance plan, a good number of them are current on their mortgage. Right? They're in the plan, but they're still making their payment. It was just sort of like they were offered a free insurance policy and they took it. So I think there's been a lot of, and again, those are anecdotal. So I think that there's going to be a wave. Certainly when the national emergency ends, which, we don't necessarily know when that date will be, but, a lot of the provisions from the CARES Act, end 3 months after the national emergency ends. So the longer that gets pushed out, I think the more credits have the ability to earn, to reserve, to work through, sort of the loss mitigation things that they need to do to keep members in their homes.
And I know you talked about the fee earlier too, and the possible effect that could have. And I know ourselves and a lot of others are really focused on, writing joint letters and trying to get the agency not to do that. But do you all have an idea, or have you heard from the credit unions you work with, on any impact that might have on what the refinancing piece? Because it still seems that the rates are so low that it's still an advantage for people to do it.
Yeah, I think that's interesting, and many credit unions and many lenders and some credit unions have been trying to slow down their volume by pricing refinances higher than purchase money, and I think that's sort of what this is I call it a tax on. I think that the quick back of the envelope analysis I've heard is it may raise rates by about 1/8 of a point. So if you were able to get a 3% loan, and maybe you're at 3 1/8 now. So still historic low levels, right? Very low levels. Members are going to improve their cash flow, but maybe it's just not as good. I think the impact though, if you booked loans and you have loans that have locked it in the pipeline for a September delivery or later, that's money that's coming out of the credit union's pocket, right? I don't know that most credit unions are going to go to their members and say, hey, by the way, things changed. That could be real. And I was on a call yesterday with the credit union, and they think that could be they're a large mortgage lender, but they think that's about a $400,000 impact.
Wow.
Right. So that's real money.
On top of the other challenges.
Yeah.
So let's see. I don't see any other questions, John and Sam. I can't thank you both enough for being with us and for your partnership. This was fantastic information, especially to get that regional picture compared to what's going on is incredibly helpful. So thank you guys. If you guys want to stay until the end, you're more than welcome, and we could get some more questions as time goes here. But without further ado, I don't want to take away from our good friend John, who has been our resident expert in many of our town halls. So with that, I'm going to go ahead and hand it off to John. And John, I'll go ahead and walk through like we've done in the past, and just let me know if I'm not keeping up.
Okay, that sounds great. Let me also add a shout out to John and Sam and to the folks at Callahan. Every time I hear someone from Callahan, I am amazed at how timely and comprehensive and precise the information is. And I always learn a whole lot. And I know that our joint credit union community really appreciates it. I thank you. What I'd like to talk about is what has come down the pike in the last month or so regarding the coronavirus epidemic and how we need to respond to it. There are 4 topics here, and one of them is terrifying, but it applies only to Virginia. The rest, I think, are interesting and timely things that we need to think about. The topics are some new federal OSHA guidance on reopening. Then we'll segue, and even though I have a lot of slides on this, since it's Virginia only, I do want to just give the 30,000-foot view on it. Virginia has new mandatory occupational safety and health regulations that if you're in Virginia, you need to be aware of them. They're kind of scary. Then third, I want to talk a bit about an unconnected issue, which is a decision early August 3rd, from a federal court in New York, the U.S. District Court for the Southern District of New York, which sits in Manhattan. You may well have read press reports that the court has invalidated some of OSHA's, rather the Department of Labor's, U.S. Department of Labor's regulations on the First Families Coronavirus Response Act. That's true, but it really doesn't make that much difference in the way you should be operating. But I do want to mention that since it's something that got a lot of press coverage. And finally, how we're going to deal with employees who have children and their children are now going to be home all day. And that is, to me, a very worrisome issue, because it's something that everyone is confronting, not only credit unions, but all employers. And there really is no one good answer on it. So let's talk first about this new OSHA guidance. If we go to the next slide. There was a guidance that came out very early from OSHA. It was back in March that said how to prepare for coronavirus. And it was extremely useful. Even though it's guidance, it's not mandatory. OSHA then issued another new guidance document that is very, very useful, and this is on return to work, although it's much more general than I would have expected. They are, you'll get the slides and you can click on those and download them and read them in your copious spare time, because as we all know, running a credit union is probably, a part-time job. And you guys are sitting around thinking about golf all day. So if you do have lots of extra time, you can download these and read them. But the summary of what the new guidance says starts on the next slide. Yeah, that one. It's important to note that this is not a regulation, it's not a standard, it's not a law. It's guidelines and recommendations. It does describe some existing mandatory rules, but one thing it makes very, very clear that face masks, despite their usefulness, are not considered to be PPE, personal protective equipment. And that's very important because OSHA has very detailed rules on what PPP is, as particularly respirators, and what you have to do if you are using PPP in the workplace. And at the very beginning of the coronavirus pandemic, back in the first week in March, before anything was coming out, there was a lot of confusion about whether surgical masks, even N95 masks, or just face coverings constituted PPE for purposes of respiratory protection, and they don't, which is good, because there are incredibly detailed regulations under Section 1910 of the Code of Federal Regulations on respiratory protection. You don't have to follow any of that. None of the credit unions that I'm aware operate in any sort of environment where respirators are important. So we're not talking about PPE. Next slide, if you would. What we are talking about is the obligation that all employers have under what's called the OSHA General Duty Clause, which requires every employer to provide a workplace free of recognized hazards likely to cause death or serious physical harm. And it's called a general duty clause because it covers everything that otherwise wouldn't be carried under specific regulations. OSHA has hundreds of specific regulations, but there's always something that they leave out. For example, there's no regulation on what happens if somebody brings a wild elephant to work, but that would be covered under the general duty clause. The general duty clause is sort of that catch-all thing that we all have in our personnel policies, which says don't do anything stupid. The guidance also refers to non-essential businesses, but it does incorporate recommendations, suggestion, and ideas that are appropriate for credit union functions. We all know that credit unions are essential businesses because they're financial institutions. They're included in the strategic plan the U.S. Department of Homeland Security has put together for defending against cyber attacks, which is how all the states decide what's essential. But in some of our operations, especially back office operations, we can look to the non-essential business regulations for some guidance as well. Next slide. It's also based on this phase 1, phase 2, phase 3 thing that we're all familiar with. As you know, DC, Maryland, well, not DC, Maryland, Virginia, Delaware, we're all in phase 3 now. And the OSHA plan really doesn't align with the reality of phase 3. It sort of was written in late June, assuming that phase 3 would be everything's back to normal, and it's not. But again, it does provide some useful recommendations. Next slide. There are 9 principles here. Almost every credit union that I've worked with has recognized virtually every one of these. Hazard assessment, who is at danger of being exposed to people who may or do have the coronavirus. Hygiene is the general term for everything we've been doing since the beginning of March. Hand washing breaks, 20-second social washing, disinfectants, etc. Social distancing, the identification of sick employees and their isolation from the workplace, the manner in which employees return to work after being sick or exposed to a sick person, engineering and administrative controls, which is something we have all done. I think every credit union with which I work and of which I'm cognizant has engineering controls such as plexiglass. That's what they're talking about. Flexibility, including telework when it's available, specific training on how to recognize the symptoms of COVID-19 infection, which is important because, as you know, they keep changing. When we were first thinking about this in March, the symptoms were things like an unusual change or loss of the sense of smell or severe respiratory distress. And those were fairly easily identifiable, especially when they weren't associated with another condition. Now, the symptoms include things such as headache, muscle ache, fatigue, and everything else that we normally have. So we need to be a bit more clear with our employees that these are otherwise inexplicable symptoms, but training and then anti-retaliation. And there is, while this guideline doesn't set out itself specific provisions, there is a statute in the Occupational Safety and Health Act of 1970 that prohibits retaliation against an individual for making a complaint either to a state or federal official that OSHA is being violated. Unfortunately, OSHA stands both for the agency and for the act. They both start with A, but that's essential. And as I say, most credit unions are exercising all of these. New OSHA guidance specifically says you should have workplace screening for worker health. You should have temperature checks. One thing that I hadn't focused on, though I knew it deep down someplace because I wrote a chapter in an OSHA compliance book during the Warren G. Harding administration, is it's fine to do temperature checks for your employees when they come in. It's fine even to keep a record of those, although you don't have to. But for goodness sake, don't have a doctor or a nurse or a healthcare technician take it. because under OSHA, if you have a healthcare professional take the temperature checks, those become OSHA medical records, which you must keep for 30 years after the employee leaves you. So if you're thinking about how wonderful it would be to have a licensed practical nurse doing the temperature checks, don't. Have a member service representative do it. The most pressing issue, of course, is return to work after exposure. And this is where the OSHA guidelines, the new ones, give us the least comfort. They just say to refer to the CDC guidelines on that. And we'll talk about that in the context of the Virginia OSHA. And again, there are things that as essential workplaces, credit unions can do that are not necessarily consistent with what the OSHA guidelines say, because they are made for non-essential businesses. Let me talk to those of you in Virginia for a couple of minutes. You should be very scared. The first in the nation state-level occupational standard for COVID-19 issues was published by the Virginia Occupational and Safety and Health folks on July 27th. It became immediately effective, which surprised everyone. In fact, based on a couple of phone calls made that morning, it surprised the head of the Virginia Occupational Safety and Health folks because it was supposed to be effective after 30 days. But it is in effect. It does have deadlines for training and in some cases for the preparation of a preparedness plan. In other words, it has teeth. After I found this picture, I realized that the tiger was probably yawning, but it has teeth. It is a formal mandatory regulation for the folks in Virginia. Next. There are, new slide. Ooh. If I ever learn how to do this myself, John will be out of a job. There are 4 different risk groups identified in it: very high, high, medium, and low. And there are, it's different than what the Occupational Safety and Health Administration initial March COVID guidance said. I think under the initial March Occupational Safety and Health guidance, most workers in an office, including people who were working at branches and working in basic offices, were medium. These definitions are different. I think what you're going to find out is that you're going to have both medium risk and low risk employees, which the distinction is important because for medium risk employees, if you have more than 11 medium risk employees, you must prepare by September 25th what's called an infectious disease preparedness plan, which is a document. There are also formal training requirements for your medium risk employees that don't apply to your low risk employees. Next click. The very, very high risk folks are, well, let's click past this because I don't want to go through this in some detail because it's important, but it's only Virginia. The high risk and very high risk people are the people you'd expect. Healthcare workers who work with COVID-19 patients, mortuary workers preparing their bodies, dentists, EMS people. Medium risk includes folks who have minimal occupational contact with other folks or the general public who may be infected but who are not known to be infected. So I think the medium risk application, as we show in the next slide, is probably your member service, MSAs. Examples that VOSH gives are retail store employees, call center employees, convenience store employees. Now, maybe if you're only doing drive-through services or only non-personal contact services, MSRs may be in the low risk area, but it's not at all a sure thing. I think that they probably, when you evaluate it, will be found to be in the medium risk. Back office people, I think, will be low risk. Those are folks who have minimum occupational contact, such as in an office building setting. The real question is whether you can take medium risk folks like your member service representatives and make them into low risk folks with controls, barriers, distancing, and the like. It's kind of iffy. Why is this important? If you have 11 or more medium risk employees, you have to have formal training that everybody has to sign off on and has to be in person. You have to have stuff that's prepared for the training. You have to have a formal infectious disease preparedness plan for those medium risk employees. Now, if you only have 4 tellers, you don't have to worry about this. But if you have 11 or more, and not in any facility, but throughout the credit union, you're going to have to treat them as these MSR medium risk employees. If you have only 6 medium risk employees and everybody else works in the back office and they're low risk, you still have to train the medium risk employees, but all you have to do is give a handout to the low risk employees. And you don't have to have a formal infectious disease preparedness plan. This handout is going to be prepared by the Virginia Department of Labor and Industry and disseminated on their website prior to the August 26th deadline, but it hasn't yet, or at least it hadn't when I looked for it this morning.
John, we have a quick question. Somebody said our back office is in Virginia. Our branches are not in Virginia. Does this standard apply only to VA central office or also to the branches that are located outside of Virginia?
It applies only to individuals who work within the Commonwealth of Virginia. So it will apply only to the back office in that case, in that example.
Okay, great. Thank you.
An excellent question. Let's go to the next slide. Oh, yeah. If you want to read all the requirements, you can click on this and you can see the Department of Labor and Industry's 110 slide PowerPoint for brief training. What I just want to do this morning is headline some of them, and if they are things that you think might be applicable, we can do it. Formal training for minimum risk employees, educational training, handouts for low risk employees, a formal exposure assessment, a formal risk assessment, which can be one-page documents, and mandatory stay-at-home for infected persons or people who are suspected to be infected, including contractors. You're not allowed to let them into your building. The most important differences are on the next slide, which are things we haven't seen before. Virginia now requires mandatory reporting of confirmed positive cases. And you have to report that to coworkers, maintaining confidentiality as to who's infected, to the Virginia Department of Health, to the owner of the building, and all the reports must be made within 24 hours of confirmation of the case. If you have 3 confirmed cases within 14 days, you also have to report to the Virginia Department of Labor and Industry. That requirement is brand new. For letting people back to work, something else that is new. The VOSH standard, and this is consistent with the August revisions to the CDC guidance. Okay, the CDC is going to a symptom-based strategy on determining when people come back to work. So even if you're not in Virginia, I think you'll be interested in this. The symptom-based strategy lets people come back to work when at least 3 days have passed since recovery, which means no fever. So 3 days without fever, improvement in respiratory symptoms, and 10 days have passed since symptoms first appeared. You can also do, as the next slide indicates, a test-based strategy for returning, but like the CDC, VOSH doesn't like test-based strategies anymore, and it only takes molecular assay tests. No blood testing, no serologic testing is authorized. And it says resolution of the fever, improvement of the symptoms, and 2 negative tests at least 24 hours apart. Luckily for all of us, the molecular assay detection of SARS-CoV-2 RNA is the Q-tip up the nose test that everybody's using. So those are returned to work. There are a whole lot of other requirements. I won't go through and read it. Most of us are doing all of those. The last thing I want to mention on the Virginia OSHA stuff is that and this goes back to those tiger teeth, this is a regulation, it is mandatory, and it has teeth. Repeat or willful violations, $135,000 a pop. Now, it's likely that we're not going to find a whole lot of those. But each violation can be worth a civil penalty of a few hundred or up to a few $1,000s, even if it's not a serious violation. And $14,000 almost for serious ones. So if you're in Virginia, watch about that. The next series of slides talks about this New York court case. It is a fascinating court case for reasons that have nothing to do with credit unions or complying with the regulations. And I really enjoyed reading it, but I won't talk too much about that. What happened was the state of New York, I'm sorry, we got a question here from Chris Williams. A bit off topic, but is the Maryland State of Emergency Order specifically, still in effect as it pertains to expired ID? I don't know about the expired ID provision. The state of emergency is still in effect, and it has been extended. But I'll have to get back to you on the expired ID question.
Yeah, we haven't. Everything we've been told, John, is that whatever was in the executive orders previously, until the executive order is actually lifted, that they're in place. But we can get back on that specific item.
Yeah, I was reading the August 3rd executive order this morning. I did not see any lifting of that, but I'll have to check on it.
We also have another question. Do you think that the Virginia guidelines will become mandatory for Maryland as well? I can say we haven't heard that per se, but I'll leave that to anything that you might have heard.
No, I haven't heard that, but as they got a lot of press, nationwide, and they are the first in the nation, so those things tend to be models. And I wouldn't be surprised. I mean, as I say, I've heard nothing about Maryland or DC or Delaware or Pennsylvania adopting their own regulations. We did have about a month's notice that Virginia was going to do this. I wouldn't be surprised to see other states adopt very similar regulations.
Right.
Did I go? Good. So New York State sued the Department of Labor and said, we got an answer. Okay, Governor Hogan has ordered an extension of all driver's and business licenses. They will not expire until the 30th day after the state of emergency has been lifted. And they're asking you to hold off if you're expiring. And the state of emergency isn't anywhere close to having been lifted.
Right.
Anyway, New York said the Department of Labor is misinterpreting the statute with these regulations. And they struck down several parts of the Department of Labor regulations. The first thing they struck down is the Department of Labor rule says employees who didn't have work can't get emergency paid sick leave or expanded FMLA because the statute said that's available to employees who can't work because of the qualifying conditions, such as staying home for the kids. So the Department of Labor said, if your employer has no work for you, you're not staying home in order to care for the kids, you're staying home because there's no work for you. And the court said that rule was invalid. And there's a reference here to the court did not afford the agency full Chevron deference, which is one of 7 levels of administrative deference. You don't care about that. But what you do care about that is if you don't have a job for somebody who's been working with you and that's the reason that they're staying home, then if one of the other qualifying conditions are also met, they're entitled to leave under the Families First Coronavirus Relief Act. The second thing is that the DOL said you get intermittent leave under either emergency paid sick leave or the expanded FMLA only if both the employer and the employee both agree. The court ruled this was invalid. The employee can take intermittent leave without employer consent. Although they upheld the regulation saying that you can't take intermittent leave if the reason that you're out is that you have an infection. You can't get sick, stay home for 2 days, come in for 4 days, and then go home sick again. But for you're caring for individuals, or you're staying home for kids whose schools or daycare is now unavailable, the court said the employee has the right to take intermittent leave, just like under the standard Family and Medical Leave Act, and the employer doesn't have to agree. The last thing the court said, which is kind of interesting, is there is a regulation that says the employee must give prior notice whenever they want to take leave under the Families First Act. And the court said, reading this regulation, it appears that the Department of Labor is requiring prior notice even when it's unexpected leave. And the Department of Labor said, no, we're not doing that. But the court said, well, it sounds like you are. And since it sounds like you are, I'm going to strike down that part of the regulation. So this is the bottom line language from the court, so you can read it at leisure when you download the PowerPoint. The most interesting part of this has nothing to do with credit unions. It has to do with self-exclusion of healthcare professionals. But the other parts are interesting. And I think most credit unions have been complying with the modifications that the court suggests are necessary. We've been allowing employees to take intermittent leave. We have not been requiring them to provide all the documentation for their leave before they go out on unexpected leave. I think that it's something that is very interesting, got a lot of press, but it's not really going to affect the way we have been operating over the past couple of days. Now, the last thing I want to talk about, which is the scary thing. I don't know how many people are old enough to remember when the song Maggie May was either the #1 or #2 song, depending on which polls you look at for 1971. But it's a 16-year-old singing, I really should be back at school, but maybe I won't. And as the next slide indicates, they ain't gonna be back. I'm sorry, the next two slides just reiterate things that we've known for a while. Both the expanded FMLA leave and the emergency paid sick leave provisions allow leave. Let's go one more back because I want to refer to some of the, there we go. I want to refer to some of the language. That's fine, we can leave it there. Some private schools might open, but many employees have exhausted both their expanded FMLA leave and their emergency paid sick leave to stay home and take care of a kid who has no child care because of the pandemic. And as the next slide indicates, that's going to be a problem everywhere. DC public schools are all online. Maryland allows local decision, but at this point, PG County is virtual for at least the first 2 quarters. Montgomery is virtual. Frederick is virtual. In Virginia, it's again local decision. Arlington, Fairfax, Loudoun, Prince William, they're all virtual for at least the first semester. Public schools are not going to be open in the sense that they will allow students to come. What happens? Well, first, if you're in the District of Columbia, there was an amendment to the DC Family and Medical Leave Act back in March that said an employee who's unable to work as a result of the circumstances giving rise to a public emergency gets DC FMLA leave. The state of emergency in DC currently is set to expire October 9th, but it gets extended every time there's a new proclamation. That was modified at the end of May, as the next slide indicates, to make it unpaid COVID leave for, in DC, anyone who has a need to care for a child whose school or place of care is closed or child care provider unavailable. And the Office of Human Rights issued guidance in July, which scares me. It says, does using COVID-19 leave count against the traditional 16 weeks of family and medical leave provided by DC FEMLA? And the Office of Human Rights says, no, this is a new type of leave in addition to family leave. So let's think about what that means for a minute. Under the Federal Family and Medical Leave Act, if an employee is eligible for expanded FMLA leave, that is, they have to stay at home to take care of a kid because their school is closed due to the pandemic, the 4 weeks, 5 weeks, 6 weeks, 10 weeks of that leave that they take counts against their annual federal 12 weeks of FMLA leave. Based on this Office of Human Rights guidance, that's not the case in DC. And it appears what the Office of Human Rights is saying is that a DC employee has the right to take 16 weeks of unpaid leave to stay home and care for a kid, which doesn't count against the traditional 16 weeks, and this is 16 weeks every 2 years, doesn't count against the traditional 16 weeks under the pre-existing DC FMLA leave. Now, that is very scary. The next slide, if you would, because normally DC FMLA leave runs concurrently with federal FMLA leave. If this interpretation is correct, we need to give notice, we need to provide DC FMLA notice when people take FMLA leave, we need to make sure the posters are up. But if this is true, if the way the Office of Human Rights in DC is interpreting this, it is a very scary thing, because you're looking at somebody who has 16 plus 12, 28 weeks of leave that they have as a right to take in case they're caring for kids. Now, if we go to the next slide, we will note that thankfully Maryland and Virginia don't have a similar arrangement. The Maryland parental leave law, Maryland flexible leave laws, they don't apply to this situation. They apply to adoptions and sicknesses and things like that. So the two questions we need to ask ourselves are, what's the minimum legal floor? What do we have to give our employees? Because we can't not give it to them. We can't discourage them from taking it. We can't retaliate against them for taking it. They have a right to it, and we must give it to them. What's the legal floor? And let me clue you, the legal floor is not going to be enough for anybody with kids in the fall semester. So the second question is more important. What can or should our particular credit union do under our particular circumstances? What can we afford to do in terms of money? What can we afford to do in terms of staffing? And there's going to be a wide variety of responses as varied as the various credit unions. I mean, if you have a credit union with 6 employees and 2 of them need to go on leave and they have no leave left, well, you can go to the next slide. Your first option is to fire them. If the employee's exhausted all of the required federal, state, and local leave, you can fire them. And is that a difficult thing to do? Yes, because if I've learned nothing else about working with credit unions over the past decade, it's that credit unions, unlike other financial institutions, which we won't name, banks, credit unions have a heart. And we're there not only for our members, but also for our employees. And it's very difficult to put someone to a choice between taking care of their kid and coming to work. But if someone has exhausted all of their legally required leave and they have a 3-year-old at home and they can't get anyone to take care of it and they can't come to work, the credit union has a right to terminate and replace that employee. Now, should that be the first go-to instance? No. As I say, the employee is entitled to expect, I think, although not legally entitled to expect that the credit union will act with kindness, gentleness, and flexibility and see if there's anything short of termination that the particular circumstances of that credit union will permit. But bottom line, if they have no legally required leave left and they can't come to work, then they can't come to work. and you fire them just like somebody else who would. Let's flip back. I just wanted to make one more point on that prior slide, if you would. As an employment lawyer, I hate it, or I have hated it for many years, when people exercise discretion. I mean, discretion in the 1980s and 90s, at least, was a code word in some cases for discrimination. Why did you fire Jane and not Joe? Oh, we exercised our managerial discretion. Let me clue you. Hard times are here. We're in a recession. It ain't going away. Hard times are going to stay. I loved the Callahan presentation that seemed to suggest the credit unions are doing well. But the economy as a whole is going to stay in the tank for a long time. I mean, it's not going to go away in October or the first quarter of next year or the second quarter. And given those hard times, we have to protect our better performing employees. Obviously, in a non-discriminatory way, uniform treatment of all protected categories. But I urge you, when you're making your decision on what to do with someone who has exhausted all of their leave but still has to stay at home with a 3-year-old, exercise your discretion to keep your better performing employees, so long as it's exercised in a fully non-discriminatory fashion. Some more options on the next page. Obviously, telework, if you have employees who can do their jobs remotely. It doesn't have, I'm sorry, I've got a question, so I was distracted. There are lots of situations where the employee might not be able to telework. But if they can telework, you should allow it. Now, one of the things that's important is that if they're staying home to take care of a 3-year-old, their telework time and their primary caregiving time should not overlap. I've looked at a number of policies for credit unions, and one of the invariant comments that I have is to say that when you're teleworking, you're not taking care of the kid. So telework during nap time, telework while the kid's in the playpen, but it's inconsistent with doing good telework to have the baby on your lap and hitting the keyboard like my cats always do. Question we got is, if an employee in Maryland asked to be off to help her child with online studies, they can get up to 12 weeks paid leave, correct? No. But if an employee in Maryland asked to be offline because they have to care for their child while the child is not going to school because the school is closed because of the pandemic, then they get the 12 weeks paid leave. If they want to help their child with online studies, that to me raises the presumption that the individual student is not a 3 or 4 or 5-year-old. It's probably a middle schooler or a high school student. And I think that telework is something that your employee can do, if the position supports it, much more easily with a 13-year-old in the house than they can with a 3-year-old in the house. And the ability to help somebody with their online studies is not a category that gets you leave, but it probably almost always overlaps with a category that does get you leave, which is the need to be home with a student who otherwise would have been at school in order to care for that student. Now, this is going back, and this is old news, this is a couple of months ago, but as you may recall, the Department of Labor regulations say if the kid is 14 years or older, you need special circumstance. If the kid is over 18, you still may need to be home if they require custodial care. But the answer to that question is, if an employee has a kid and they need to stay home to take care of the kid, that is permissible under the Families First Coronavirus Response Act. If the only reason they're staying home is to help the kid and somebody else is there to take care of the kid, then they don't get the leave.
John, one part of that question was, can they ask the employee to request the school send a packet home so they can force them, or, so they can have their child? Is that something within the realm of the institution's ability to ask that question, or that directive of the employee to say, well, can you request a a work at home packet so you can work in the evenings with your child versus during the day?
Absolutely permissible. The only real question comes when there's no one to take care of the kid during the day. If somebody's working from 8 to 4, there's no reason they can't help with online learning from 5 to 7 or something like that. Most of the schools, most of the public schools in the DC metropolitan region have set up a sort of a sliding scale of how much time the children are going to be expected to be in front of the computer with their classes, and in no cases at 8 hours. I mean, younger kids 2 to 3 hours, middle schoolers 3 to 4 hours, high school kids 4 to 5 hours. I saw one jurisdiction that said 5.5 or 6 hours. But the students are always going to have time in the evening to go over the materials. Most of the online learning is pre-recorded, and it's absolutely permissible for a credit union to say, can't you get this done during the evening? Can you ask the school for an online packet?
Great,
Absolutely
thank you.
permissible. Some other ideas. Flexible shift scheduling. If you have a family where one of your employees has a spouse or a significant other or someone else living in the home who's also working, you can coordinate their scheduling so that someone's always home with the kid. You can, but are not required to, allow them to use accrued but unused PTO. Of course, that doesn't help the credit union because they're not going to be there. And again, you can fire somebody who has unused PTO for not coming to work. But that's an option you can consider. You can also consider allowing PTO to go into a deficit, not required, not mandatory, depends on the circumstances at work and how much you need this person, but that's another option. At the other end of the spectrum, temporary unpaid furloughs. Sorry, we can't keep you on the payroll right now. Call us when you no longer have to take care of your kid, but we can't guarantee your reemployment. If someone is working in a position where they can't telework, see if you can reassign them to a different position where they can telework. Again, not required, but if you can do it, it might be kind. I spent some time last week dealing with the suggestion of one of my very favorite. I know I have a lot of clients on the line, you're all my favorites, but one of my very favorite credit union clients decided that maybe what we should do is just have everybody bring their kid to work. We'll set aside a conference room and we can, seal the kids in it or something like that. Don't do that. That's scary. Among other things, it requires background checks, sexual predation checks for everybody who's coming in contact with the kids. It requires, in Virginia at least, that you have a graduate degree in nursing or childcare. I mean, bring your kid to work day is okay. Bring your kid to work month. It makes you a daycare center with all those regulatory requirements. So it was what I said to the client was, this is an interesting and innovative solution which you should abandon immediately. And this is my final word on that. Two things. The very first document I sent out to any credit union client, which was in February about the pandemic, was be flexible and be gentle. Because around the edges, there's always an employee trying to scam the system and get more leave than they're entitled to, or take it, in wrong circumstances. Here, by definition, they have a kid who needs to be taken care of. Don't, if you can possibly avoid it, force your employees into choosing between their job at the credit union and their child. Because if they choose the job over their child, you probably don't want them around anyway. That's poor judgment. Not every credit union will be able to, and I don't want to use the word accommodate because it's a term of art in the ADA, not every credit union will be able to assess options that would allow the employee to keep their job somehow after their legally required leave comes out. But if you can, and it's a good performer especially, do it if you can. But the final thing to say is, remember, our primary obligation is to our members to ensure quality service. And if you have, 10 employees and and 4 of them go out or want to go out, that ain't helping nobody, because you will be in a world of hurt from getting the work done to compliance oversight to making sure all the little things that need to get done every day get done. I wish I had really good options. I wish I owned a child care center at this point, because I would open it to all my credit union friends. But that's what I have to say about that, John. And thank you for letting me bloviate once again.
John, thank you so much. It's always a wealth of information, and I want to thank everybody for staying on with us. I thought today was fantastic. Great questions, great feedback. We will have the town hall up and ready as far as being able to download the deck along with the recording. Will be done hopefully later this afternoon, at worst by tomorrow morning. Did want to just remind everybody our virtual tech summit this year is next week. There's still a few days left to register, so it's a packed 2 days of just some incredible speakers and information. So again, I think we've actually been able to stick with our hour and a half today. So that was fantastic. Thank you all for joining us. Thanks for being a part of this. If you have any questions, in our information here is also our resources from the association for you. And you kind of saw a little bit of that with Michelle's quick answer to John and I while we were going through on the executive order with IDs. So again, thank you all very much for joining us. If you have any questions, please don't hesitate to reach out, and we'll see you at our next town hall in a few weeks. All the best, everybody. Have a great day.